Good morning, everyone. Today we are going to discuss about second part of urogenital system. Means the development of urinary bladder and urethra. As you all know, previously only we discussed about this that urogenital system consists of the urinary system and the genital system. In urinary system, kidney and ureter is already done. Now we are going to discuss about bladder, urinary bladder and urethra. Okay, so as such, the source of origin, as we discussed earlier, we have mesodermal origin, which consists of intermediate cell mass, this one, which is actually giving rise to pronephros, mesonephros, and metanephros. And second important thing, which we are going to discuss in detail, is endodermal cloaca. So we can see here in this image, we have hindgut. This yellow part is hindgut. This is allantois. This allantois is opening into the hindgut, and then the post-allantoic part here is cloaca. So here we can see the cloaca here. This post-allantoic dilated part of the hindgut is called as cloaca. So as such, in 4th to 8th week of intrauterine life, what happens here? A mesodermal tissue, which is called as Uro-rectal septum, it comes downwards towards this. This is called as cloacal membrane. This is cloacal membrane. So this is coming towards the cloacal membrane and it is dividing this part of the hindgut, the post allantoic part of the hindgut, cloaca, into two parts. We can see here one is ventrally, one is dorsally. The ventral part, this is urorectal septum. The ventral part is actually called as this one. This is called as urogenital sinus. The dorsal part here is called as urorectal canal or primitive rectum. And here it is also dividing the cloacal membrane. So it is coming downwards and reaching up to the floor. That means middle of the cloacal membrane, where in front ventrally or anteriorly it is called as now the urogenital membrane, and behind it is called as anal membrane, and the tip of urorectal septum here will be called as perineal body. So perineal body is in between the opening of rectum behind, and in front we have opening of urethra. Okay, so as such, this is a chart we can make out very easily. You can understand from this here. You can see we have cloaca, which is post-allantoic dilated part of hindgut. Again and again, I'm repeating so that you cannot forget this. What is cloaca? Now, cloaca will be divided by the urorectal septum into primitive urogenital sinus ventrally and anorectal canal or primitive rectum dorsally. So this anorectal canal will form rectum and upper part of anal canal, which will be discussed in the hindgut development of GI tract or hindgut. Now we are concentrating here, this part today. The primitive urogenital sinus will be divided into proximal part called as Vescico Urethral Canal and distal part called as definitive urogenital sinus. Vescico Urethral Canal will be forming the urinary bladder and primitive urethra, and definitive urogenital sinus will be forming pelvic part and phallic part, which will be forming the part of urethra. So here, definitive urogenital sinus will give rise to the pelvic part and the phallic part of urethra. So we'll be discussing all these things. Now cloaca here, as I said, primitive urogenital sinus. This primitive urogenital sinus here, it is communicating with allantois, and on each side it has opening of this blue part called as Mesonephric Duct, which you all know, and the floor of this will be formed by here, this floor. The floor is formed by urogenital membrane. And so this is your urogenital membrane, and behind we have anorectal canal, where the floor will be formed by anal membrane. So cloacal membrane has two parts, urogenital membrane and anal membrane. Okay, and now we'll discuss primitive urogenital sinus. So this is anal membrane, and this is anal membrane, and this is urogenital membrane. Now this diagram I have made for you, I have done this drawing of this diagram so that you can also can easily draw from these diagrams. Okay, here you can see yellow I've represented here the gut part. So this is allantois, this is your cloaca here, this is hindgut. Okay, blue I've mentioned here, blue as the mesonephric duct. So this is your hindgut, cloaca, mesonephric duct, and this orange part here is ureteric bud, and this brown one is your metanephros. Now see here, this mesonephric duct and bud, this is bud arising from mesonephric duct. After that, this part, the part which is caudal to the opening of the mesonephric duct, this will get absorbed over here, And now see here in the second diagram, we have opening of the mesonephric duct and the ureteric bud at one point on the dorsal wall of developing cloaca, or you can say the primitive urogenital sinus. Okay, so now gradually what happens as the ureter grows and with the ascent of kidneys, this part, the opening of the ureteric bud will be shifted up, whereas the mesonephric duct is shifted downwards. So this is the posterior wall of the urinary bladder. Again, another diagram I have drawn for you so that you can also copy and you can also draw. Okay, so initially we have these two openings, mesonephric duct and we have ureteric bud arising. Later on, they both, the caudal part get absorbed in the posterior wall and both they come together here. Okay, so mesonephric duct opens at the junction of Vescico Urethral Canal and definitive urogenital sinus. Part of the mesonephric duct, which is caudal to the ureteric bud, gets absorbed into the dorsal wall of Vescico Urethral Canal here. Okay, then what happens? Now the mesonephric duct, the orifices of the mesonephric duct moves close together to enter into the prostatic part of the urethra, and in the male they become ejaculatory ducts. So this part of the mesonephric duct will form ejaculatory ducts, which we'll discuss again in detail in genital system. And this blue part here is actually representing the trigone part of the bladder, where it is showing this part of the bladder is formed by absorption of mesonephric duct, and therefore it is mesodermal in origin. Rest all will be endodermal in origin. And this is ureteric bud. Openings of the ureters here now. Ureters have developed. So the openings of ureter will be shifted cranially, and openings of these mesonephric duct will come downwards and they will open into prostatic part of the male urethra. This is the picture. The same picture is from the book Langman's, but I have drawn it for you, okay, so that you can also practice. Thus, the mesonephric duct and the ureteric bud or ureter, they open separately in the urinary bladder. As a result of ascent of kidneys, the orifices of the ureters move farther cranially, as I already mentioned. Okay, now coming to the bladder development as such. So we have actually four things here. One is epithelium, epithelium of trigone. Epithelium means epithelium of whole bladder except epithelium of trigone. Then we have part near the apex and we have musculature. Okay, muscles and connective tissue. So this is your urinary bladder, a bag-like urinary bladder. We can see this wall is rough. Major part is irregular here because of the mucosal foldings, and some part here in the posterior wall is smooth with two openings. This smooth part is trigone and then it is opening here downwards. This is your urethra. This is female bladder actually. This diagram again I have made for you to show you each and everything how it is derived. So major part of the epithelium except in the trigone part, all part is derived from cranial part of the Vescico Urethral Canal. As I mentioned earlier, the primitive urogenital sinus has two parts, the proximal part and the distal part. Proximal part was called as Vescico Urethric Canal. That Vescico means bladder. So cranial part of the Vescico Urethral Canal forms urinary bladder. Caudal part will form the part of urethra. And because it is part derived from cloaca, which is actually part of hindgut, post-allantoic part of the hindgut. So hindgut is all endoderm. So major part of the bladder is endodermal in origin, but the part which here along the dorsal wall or the posterior wall, or you can say the area of trigone, is because of absorption of this mesonephric ducts. So epithelium of trigone is mesodermal initially, and some part near the apex where we have attachment of urachus, this is actually derived from or you can say contributed by some part of allantois. So part of urinary bladder near the apex develops from the allantois, and ultimately this part gives attachment to median umbilical ligament in adults. And rest all musculature and connective tissue will be derived from Splanchnopleuric layer of lateral plate mesoderm. So this is a diagram which you can practice. A full image I have shown here just to so that you can practice this diagram. Near the apex we have, I have used different colors. So this is actually the continuation of allantois here. And this part is from cranial part of the main part of the body. Epithelium here is derived from Vescico Urethral Canal. Part near the dorsal part, that is where we have trigone area, is actually mesodermal because of absorption of part of the caudal part of the mesonephric duct. Okay, so these are the different parts where you can make out. We can share, we can practice this diagram also. Okay. Now, with the time, they say the mesodermal lining of the trigone, which is actually from mesoderm of the mesonephric duct, is actually replaced later on by endodermal epithelium. So that finally the interior of the bladder is completely lined by endodermal epithelium. So initially it is endodermal and a trigone part is mesodermal, but later on completely it becomes endodermal. So initially, I told you here we have allantois part. So near the apex, we have the allantois attachment, the opening of the allantois. But gradually, what happens soon after the birth, this allantois part constricts and becomes a thick fibrous cord called as urachus. In adults, this part is called as median umbilical ligament. This is actually important. This urachus or median umbilical ligament. Usually, it has no role after in adults, but sometimes there can be some congenital anomalies related to this urachus or median umbilical ligament. We'll discuss later on. Now, if we say the position of the urinary bladder, so in infants and children, the bladder, urinary bladder is more or less, it is abdominal. It's not completely pelvic. Okay, even when empty, it lies in the abdomen, may reach up to the umbilicus also. Okay, but uh, with after with development, you can say, as the children grow, it begins to enter the greater pelvis to approximately 6 years of age, and it becomes completely pelvic organ only after puberty. So initially when the baby is born, bladder is in the abdomen, also in the infraumbilical part of the abdomen. By 6 years of age, it comes down and occupies greater pelvis. Now what is greater pelvis? We can see this is the bony pelvis. This red one is pelvic brim. Anything which is above this the red margin is called as greater pelvis or false pelvis. So after by about 6 years of age, it begins, the bladder comes to enter into the pelvis, greater pelvis, at approximately 6 years of age. So less than 6 years of age, still the bladder is above the level of this pubic symphysis. That means this is important because sometimes if there is an urethral stricture or urethral closure or something is there leading to closure of the urethra, and you have to reach the bladder, you have to take out the urine, so you can puncture the bladder. But in children's less than 6 years of age, you have to remember that you can reach just above the pubic symphysis also, you can puncture the bladder because it has not gone completely below the pelvic brim till now up to 6 years of age. So it begins to enter the greater pelvis at approximately 6 years of age. Till puberty, or you can say only after puberty, it comes into pelvic organ. Pelvic organ means less than in the lesser curve, in the lesser pelvis, or you can say true pelvis, below the pelvic brim. Okay, another image where we can show you, this is for superior view. This was superior view. This is here. This is pelvic brim. Above the pelvic brim, we call it the greater pelvis, and below the pelvic brim, this area is called as lesser pelvis. Okay, so lesser pelvis, it reaches only after puberty. Okay, above puberty, after 6 years, actually till puberty it is here. Less than 6 years, it is above it this. Okay, so we have to take care of these things because clinically the position of bladder is very important. Now, what are the congenital anomalies related to the bladder, urinary bladder? So remnants of urachus, as I told you, near the apex of the bladder there can be attachment of the urachus, which later on called as median umbilical ligament. The remnant is called as median umbilical ligament. But what happens, sometimes it may be patent and the opening is opening into the umbilicus. At the level of umbilicus, it is opening out. So this is called as patent urachus, or the urine may come out. The baby is born with the urine is coming out from the umbilicus. There can be the distal part, the part towards the skin or the umbilicus is patent, and it is called as sinus, urachal sinus. Or sometimes it may happen, there can be extension of the bladder into this urachus, and it is called as diverticulum. Or in the urachus, somewhere there can be dilatation and formation of cyst or polyp leading to collection of fluid lined by the epithelium. So this is called as urachal cyst. So there can be patent urachus, or there can be sinus, urachal sinus, there can be urachal diverticulum, there can be urachal cyst or polyp. Okay, so we can see here this is sinus. See clearly, it is patent, it is completely patent. Here it is sinus, distal part is here, and you can see this is diverticulum, and this is here cyst. Okay, so these are different anomalies, congenital anomalies related to the urachus. Sometimes, or rare birth defect, a baby is born with the bladder wall, or you can say posterior wall of the bladder or trigone is visible to you. That means a ventral body wall defect in which the bladder mucosa is exposed. This condition is called as exostrophy of the bladder or ectopia vesicae. Usually in males, it is associated with some other anomalies also, which is called as epispadias, where there is opening of the urethra ventrally, sorry, dorsally, not ventrally. And here you can see the openings, you can see the ureteric orifices and trigone of the bladder are exposed. That means infraumbilical part of the anterior abdominal wall is not developed here. You are able to see the mucosa. Simply, I can say you are able to see the mucosa of the bladder. Skin is not developed. 1 in 10,000 or 40,000 live births. Even I have seen this in my internship also. I have seen this case, this kind of case in a female. So it may be caused by lack of mesodermal migration into the region between umbilicus and genital tubercles. So see here, this is the exposed bladder. This is the actually the female patient, usually common in more in female, you can say female babies than the male babies. This is the labia, the external genitalia, anal opening, and so this is your exposed bladder. Okay, this is umbilical cord stump. We can compare these. This is actually the exposed bladder. Openings we cannot, the urethral opening we can see, but ureteric openings are not clear here. Okay, so this is here will be the vaginal opening. This is anal opening. Okay, so and these are labia. Another is sometimes urinary bladder may be absent or duplicated. Like here you can see duplication. The lumen may be divided by some septum, incomplete or complete septum. This is complete septum, this is incomplete septum, so they can be separate, two separate, or sometimes they can be septa. There's a bladder but they're septa, or sometimes it is having a constriction in the middle, giving it a hourglass appearance with upper and lower compartments. Or urinary bladder may also communicate with rectum or vagina when it is called as fistula. Now this is the sagittal section here. We are able to see the bladder here. This is pubic symphysis, anterior abdominal wall. This is posterior wall. You can see the sacrum here. This is rectum. This is bladder, urethra, and this is male urethra, you can say male bladder, male section. So here the connection is between the bladder, this is urethra, and rectum. So this is called as recto-urethral fistula. Recto-urethral fistula. Rectum is not opening into anus, but it is opening into urethra. Another one you can see there is opening between the rectum and bladder. So vesico means bladder, urinary bladder. So recto-vesical fistula, recto-urethral fistula. Another condition where sigmoid colon and bladder is having connection. So this is called as colovesical fistula. Another condition in females, vagina is connected. So vesico-vaginal fistula. Vesico-vaginal fistula in females. This is colovesical fistula. They can be, as I mentioned earlier, the rectovesical and rectourethral. Right? Colovesical, vesico-vaginal. These are the fistulous connection, anomalous connection between the two adjacent organs, which are actually developing from the nearby structures or from the same structures. Okay. Another condition is a pathologically large urinary bladder may be there, which results from congenital disorder of the ureteric bud, which may be associated with dilatation of the renal pelvis. So large bladder and leading to dilatation of the ureter and the pelvis, and usually it may lead to death of the patient, or sometimes if the child, the baby is live, there can be some renal failure in early childhood. So this is called as congenital megacystis, congenitally large urinary bladder the baby is born with. Now coming to the development of urethra. Actually, the development of urethra, we say, as I mentioned earlier, the primitive urogenital sinus, the primitive urogenital sinus was having Vescico Urethral Canal and definitive urogenital sinus. So here what happens, epithelium, if we say the urethral epithelium, most of the epithelium in males is actually endodermal and it is derived from urogenital sinus. We have to remember that there was two sections, primitive urogenital sinus and primitive rectum or anorectal canal. From the primitive urogenital sinus, we had Vescico Urethral Canal and definitive urogenital sinus. Okay, so Vescico Urethral had vesical part and urethral part, and then pelvic part and phallic part of the definitive urogenital sinus. So most of the epithelium of male urethra is endodermal, okay, except near the apical part, and but entire female urethra is endodermal. Okay, most of the male urethra, because small part is there. So you can see here, this is the male urethra here, this is male urinary bladder, and this is the male urethra. Here it is a female urethra. We can see the difference. The length, you see the length, very shorter. In female urethra is very short, whereas the male urethra is very long and it has different parts. Okay, prostatic urethra, membranous urethra, and there will be spongy urethra. And so spongy urethra will be having parts, the glandular part, the spongy part proper, and the navicular part. We'll see this in details. So as such, same table, the part of the table, the primitive urogenital sinus will divide into Vescico Urethral Canal, cranial part, which will be forming the urinary bladder, and primitive urethra. The definitive urogenital sinus, the caudal part, it will form the pelvic part and the phallic part. So I can show you in the diagram here. This is your primitive urogenital sinus, where we have, this is the vesico-urethral part. Then we'll be having this caudal part here. And then we have pelvic part and the phallic part of the definitive urogenital sinus. This is vesical part and urethral part of the vesico-urethral canal. So this is vesico-urethral canal and this is your definitive urogenital sinus. This diagram is a line diagram which you can practice. This is the apex, this is the bladder. The different colors they have shown here. The urinary bladder is developing from this cranial part of the vesico-urethral canal. The caudal part of the vesico-urethral canal they are showing with yellow. This is called as primitive urethra. So primitive urethra is the caudal part giving rise to the part of urethra, and urinary bladder develops from cranial part of the vesico-urethral canal. So this is vesico-urethral canal. This blue and brown part or orange part, this part is your urogenital sinus, definitive urogenital sinus. So this blue part is called as a pelvic part, this brown part is called as a phallic part. So the female urethra, now we are discussing about development of female urethra. Female urethra as such is approximately 4 centimeters, just 4 centimeters. So the origin of female urethra is, first is primitive urethra, that means this part. Primitive urethra and pelvic part except its terminal part. So pelvic part of urogenital sinus. So there are two origin of female urethra. Female urethra develops from one, primitive urethra, which is the caudal part of vesico-urethral canal, and it develops from upper part of pelvic part of definitive urogenital sinus. Okay, and this phallic part of the urogenital sinus, definitive urogenital sinus, will form vestibule into which urethra opens. So this part will form vestibule in females. Okay, so we are talking about female urethra, which is very short. It is just formed by two parts. One is the proximal part is formed by the primitive urethra. The distal part is actually formed by the pelvic part of urogenital sinus from its cranial part, except its terminal part. The terminal part along with the phallic part of urogenital sinus will form vestibule. Okay, we can see here this female, this is bladder and this is female urethra. See here, this urethra is coming over here and this part is derived from the caudal part of vesico-urethral canal, and this part will be derived from pelvic part of definitive urogenital sinus. Female urethra corresponds to prostatic and membranous part of male urethra. That's why the female urethra is very shorter. If we compare, this is male urethra. See, this is the length of the male urethra, which we'll discuss in coming slides. Whole of the female urethra is endodermal in origin, except the dorsal part where we have mesodermal origin, small part, absorption of mesonephric duct was there. Okay. Now male urethra. Male urethra is prostatic part, the part which is surrounded by these prostate gland. Membranous urethra, part passing through a membrane over here. Then we have a dilated part called as bulbar urethra, penile urethra, and navicular urethra. So bulbar, penile, and navicular usually together they are called as spongy urethra. Okay. So what are the structures or what are the things leading to development of male urethra? First is, we are discussing prostatic urethra. Prostatic urethra develops from, so you can see here we have opening of mesonephric duct. So near the opening of mesonephric duct, that part I told you earlier, it is forming actually the ejaculatory duct. So above the opening of ejaculatory ducts, it is formed by caudal part of Vescico Urethral Canal, or we can say primitive urethra. Below the opening of ejaculatory duct, it will be formed by upper part of definitive urogenital sinus. We call it pelvic part. Okay, so prostatic urethra is derived from two things. Above the opening of ejaculatory duct, caudal part of vesicourethral canal, and below the opening of ejaculatory duct is by the upper part of definitive urogenital sinus, or you can say pelvic part of definitive urogenital sinus. So we have primitive urethra and upper part is pelvic part actually. Okay, so this is your prostatic part. Here it is surrounded by the prostate gland. This is ejaculatory duct. See, ejaculatory duct, and this is a gland here. Next is uh, membranous urethra. Membranous urethra is the one which is just adjacent to, just after the prostatic urethra. A small part is membranous urethra. It develops from lower part of the pelvic part of definitive urogenital sinus. So just adjacent. Cranial part of the pelvic part of definitive urogenital sinus was giving rise to prostatic part. The caudal part or lower part of the pelvic part of definitive urogenital sinus will form the membranous urethra. Okay, this part. So pelvic part give rise to caudal part of prostatic and membranous urethra. Next is spongy urethra. The bulbar part and the penile part, it develops from phallic part of definitive urogenital sinus. Whereas the part which is here, dilated part, this here, the navicular part is derived from surface ectoderm, indipping of the surface ectoderm. So it is ectodermal. So navicular part will be ectodermal, rest all, that means this penile part and here the bulbar part. It will derive from the phallic part of definitive urogenital sinus. Fine. So we can see here, this is a prostatic part. This is ejaculatory duct opening. Above the opening, it was derived from primitive urethra. Below the ejaculatory duct opening, this is derived from the upper part of pelvic part of definitive urogenital sinus. Membranous is completely derived from pelvic part, lower part of the pelvic part of definitive urogenital sinus. Bulbar urethra, penile urethra, navicular urethra. So bulbar are penile, they're derived from phallic part, whereas navicular is derived from surface ectoderm. So it is mainly endodermal, but except near the apical part, near the navicular, where we have navicular urethra. Okay. So endodermal epithelium, the connective tissue, and the smooth muscle of this urethra is completely in both the sexes are derived from splanchnic mesoderm. Epithelium, as I mentioned, it is mostly endodermal, except the small posterior part in females, which is mesodermal, and in males also near the navicular urethra, this is ectodermal. Okay. And by the end of third month, near about the third month, epithelium of prostatic urethra in males begin to proliferate here, and they form number of outgrowths we can see here that penetrate the surrounding mesoderm. And this here they are forming the gland called as prostate gland. In males, these buds they form prostate gland. Okay. Whereas in the females, these buds actually, the cranial part of the urethra give rise to urethral and paraurethral glands. So in females, they'll be forming urethral and paraurethral glands, where in males, they are forming the prostate gland, the buds which are arising from prostatic urethra. Now, what happens here? Seminal vesicle we can see here. In males, the seminal vesicles are formed as a budding from this part of the ductus deferens, which is actually the mesonephric duct here. So these seminal vesicle, ductus deferens, all the male genital part we'll discuss in subsequent classes. Okay, seminal vesicle here. Now the difference in male and female urethra. Male urethra is, it is long, approximately 18 to 20 centimeters. Female urethra is very short, approximately 4 centimeter. Female urethra function is only urination, whereas male urethra, urination as well as ejaculation of semen, because ejaculatory duct is opening here. Okay, and course is also curved here, so chances of injury is always more in males, whereas if accidental injuries or something, so urethra is commonly injured, whereas female it is very short, and catheterization is also very difficult in male urethra. It is easy in female urethra because it is just 4 centimeters. Okay, so this is all about the difference between the male and female urethra. I hope you understood the development of bladder and urethra. please go through these, and in subsequent classes, we'll discuss the genital system also. Thank you and have a nice day.